All right, moving on with exam 3 review. This is part 2, the last part of the exam, and let's talk about eating disorders. So let's talk a little about bulimia nervosa. Um, so symptoms you might expect to see are you could see a normal weight. You could see dental erosion. Their teeth will be yellow or brown, maybe rotting. Remember, they're vomiting a lot. You could also see metabolic alkalosis. Um, some clients could be overweight or underweight, but it's definitely going to affect their teeth. Um, they might have chipped teeth. They might have more cavities. Um, things like, you know, becoming cold easily or having low blood pressure are more seen with anorexia, not so much with bulimia. We'll talk about that in just a moment. People with eating disorders. Now, I'm going to overgeneralize here. This is not 100% of the time, but a generalization is they're very eager to please, always trying to please everyone around them, really hard on themselves, very critical of themselves, perfectionist, often really super smart or talented, and they put a lot of pressure on themselves. And their family will often describe them as perfectionists with above average intelligence. Excuse me. Um, they will often be, like the good child, really, not causing any trouble. Um, Often avoid conflict. It's an internal stress, really, this being so hard on themselves. So for the client with anorexia, they actually see themselves as being larger than they are. They have very poor judgment about their health status. And they tend to think that people are out to get them for telling them they have to eat or gain weight. They might say, well, they're just trying to keep me from looking good or reaching my goal weight or, whatever it is. You would talk to the client about the connection between food and feelings because there's a really big connection there. You want to validate their emotional difficulties. um, there's also a diagnosis of binge eating. And so if you hear someone say, there's periods where I just eat and eat and eat, maybe there's periods where I don't eat anything and then I'll eat 3 pizzas, that is binge eating. And those folks are frequently overweight and obese, and they're compulsive overeaters. Um, Folks with anorexia do self imposed dieting. They'll have a very rigid diet, like I can only eat X number of calories a day. And they'll create some extreme diet that they think they have to stick to for some reason, whether it's looking better or whatever, they'll have a reason. Um, it's important to notify the physician about any suspected eating disorder and notify a surgeon of this before surgery. is difficult to administer anesthesia to someone who is binging and purging. It's going to affect how people recover from surgery and how people recover from anesthesia. So if a client is telling you that they were binging and purging right before they're scheduled to have surgery, you want to definitely talk to the surgeon about that. You want to think about dehydration and electrolyte imbalance with a lot of vomiting. And please note the most common age groups for each diagnosis. For bulimia, the most common age group is 18 to 22. So that's going to be your first year of college, people. That'll be, late adolescence or early adulthood. So understand the age group for each eating disorder. With anorexia, I think obviously they'll have body weight less than normal for their age, height, and physical health. Let's see, what else? Read the questions carefully, okay? Note the ages. So although you might see symptoms of anorexia listed, would those symptoms be appropriate for the age that I'm talking about? And note that people with anorexia, they do feel hungry. They just work on suppressing that hunger. Think about, what does the term self-efficacy mean to you? Self-efficacy really means that the client believes that they have some control over their life. I can go to school and make things happen for myself. I can get a career. I can have a family. I can buy a house. That's all feelings of self-efficacy. Having goals, having those goals that you can do something about or with your life. Let's see. In life's mental health across the lifespan, there is some discussion of autism spectrum disorder. Please review the signs and symptoms. People on the spectrum often have little to no eye contact, less facial expressions. Kids often don't spontaneously play. And again, these are generalizations in your textbook. This is not everybody. Think about spirituality. What does spirituality mean? What is the purpose of spirituality in our lives? And I'm not talking about religion. I'm talking about spiritual beliefs. You can be an atheist and still be a very spiritual person. It's really the essence of a person's being and how you interpret the meaning of life events. That's spirituality. That's important to know because spiritual interruption or spiritual inner conflict can be tough for patients. And we see that when patients are diagnosed with a fatal disease, that really can interrupt someone's spirituality. If a client is agitated, now might be talking about seniors here. If they're agitated in the dining room, they might eat their meals in a more quiet location. Whatever is best for them to eat their meals and get their nutrition. You might remember that from level 1. Review Ritalin or ADHD medications that are given to kids and how they're given to kids. Maybe you'll end up being a school nurse and you might administer these medications. Generally, they're pretty. They can be. I know there's a longer acting one now, but for kids, generally they take faster acting drug so that they are not on prolonged medication. Now, again, of course, every child is different, every person is different, but for the most part, kids going to school, if they take ADHD med in the morning, let's say 7 in the morning, they will probably need another dose around lunchtime. Otherwise, they'll be falling asleep after lunch or unable to concentrate. They'll just crash. So generally, for Ritalin, there's 2 doses for school kids on Ritalin. Surely if you work in a physician's office, you will hear parents talking about that they don't want their kids to receive vaccines. There's a lot of parents who think that there's some correlation between vaccines and autism. There's actually no valid research that establishes a relationship between vaccines and autism. Now, of course, if you want information to support your beliefs, you can search Google and you will find whatever information it takes to support your beliefs. But in talking about actual medical research, there isn't actual research to support a correlation between vaccines and autism. And that's the standpoint of your textbook. Okay, don't come at me. I'm just telling you that's what your textbook says, and that's what the NCLEX would ask. So just understand that viewpoint. Okay, when someone is diagnosed with dementia, you know that generally progresses and becomes more and more intense. It's not something that gets better or stays the same. And so you want to help the family prepare for future care needs. So that person might need a caregiver, I don't know, in a year or a couple of years, or, depends how fast it's progressing. But, you don't want to hear a family member say, oh, they'll get better, or, maybe it'll clear up. Dementia does not clear up. All right, kind of going back and forth in the lifespan with these questions, but if you are working in a clinic and the kid is jumping around the room, which some of you have seen, kind of bouncing from the table to the chair to the floor and all over the place, as the nurse, you have to tell the kid, stop jumping. Stop jumping right now. Why are we so serious about that? Because it's a risky activity. You don't want them falling in your clinic, in your doctor's office. That just would not be good. You have to be really firm. You're not going to be threatening. You're not going to try to bribe them or whatever. You have to just be clear. Stop jumping. It's really serious because, kids fall, they get hurt. You just don't want that to happen. No dangerous activities in your medical office or wherever you're working. Okay. Jumping around the lifespan here. Let's say you're working with someone with dementia on an activity like folding clothes, and the person starts getting agitated, maybe starts yelling, really loses focus in some way. take a break and then return to the activity later, maybe in 5 minutes, 15 minutes, an hour, whatever it is. You don't have to give it up altogether. It might be important for them to follow through with that activity, but you don't want to push through it if they're agitated. So you might have to pause, give them time to calm down or refocus or whatever it is, and then pick up the activity later. Same sort of concept with kids with ADHD. If they can't get through their ADLs, you want to break up the ADLs into smaller individual steps. Let's just tackle brushing your teeth right now. Instead of brushing your teeth, pick out your clothes, get dressed, clean up your room, get ready for school, collect your homework. Maybe you just have to do one thing at a time, and get the wins where there are wins. So brush your teeth. Oh my gosh, you got through brushing your teeth. That's excellent. Then go on to the next activity. So break things up, meet patients where they are, and do the things, set goals to set them up for success. All right, that's it. If you have any questions, please don't hesitate to reach out. And that's it for exam 3. Thank you.